Thank you. And I hope people have heard me update before on the work of Thrive London, and colleagues will be familiar with the broader work that we do. And I'm just really pleased to be part of this broader update. I think Ahmed's personal testimony and his lived experience show the valuable work being done in our communities when, crucially, their needs are recognised and they're supported and empowered to lead on their own mental health and well-being. And we know that resilient individual families and communities are much more able to deal with adversity than those with less resilience. So one example of what Thrive has been doing is our work with Bounce Forward, which is support both their Resilient Futures programme for young people 18 to 24, but also their Raise and Resilience workshops for parents and carers, and we've reached over 800 Londoners through those projects. The paper also updates colleagues on the work that the Youth Mental Health First Aid Programme has said, and I think Jazz and Ahmed have illustrated the importance of that, and we know it's been a really challenging year for the education and youth sectors, and that programme has really ramped up. The programme has doubled the number of instructors in London and is expected to have enabled more than 3,300 education and young organisation staff to train as young mental health first aiders by the end of July. Other successes are under point 6, and I just want to turn to the issue of bereavement before I finish. It's been an essential challenge that Londoners have faced. The total number of deaths in London's COVID-19 with COVID-19 on the death certificate is over 19,000. And for every death, research shows that 5 people are closely affected, meaning approximately 95,000 Londoners are currently grieving a recent loss from COVID-19. And Mayor, when you launched the Blossom Remembrance Garden in Newham in the Olympic Park, you referenced the important work that Thrive was doing. And I think it's vital that that Pan-London bereavement programme is a crucial part of the mental health recovery mission and meeting the challenges that those 95,000 Londoners are facing. We have seen over 125,000 Londoners so far, with more than 2,000 accessing dedicated resources and 400 Londoners attending bereavement loss and awareness training by Cruse Bereavement Care. Through the Mayor's Resilience Fund and through working with the Mayor's Peer Outreach Team, Thrive London are also looking at further bereavement resources and support available, targeting young people, and especially those from minority ethnic backgrounds. I think challenges such as these are why a regional mental health strategy is so crucial for London now and over the coming years. And as noted in the paper, Thrive London are currently undertaking public mental health review on behalf of the whole Health and Social Care Leaders Group. And that review aims to determine the collective challenges and opportunities of public mental health over the next 3 years and to define the change model and proposals on how London can better work together across our different geographies, our different sectors, and to minimise, crucially, that long-term detrimental impacts of the pandemic on Londoners' mental health and well-being, and support all Londoners to have those crucial health and happier lives. Thanks very much for the work that we've all been doing in partnership, and as I know I've said before, Thrive's unique DNA is that bottom-up that you've referenced, Mr Mayor, but also working across all parts of the NHS and local government. And we hope to have that review published in the coming weeks. Thank you, and I'll hand back to Jazz.